Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. How are you on this Saturday evening? Hoping that you're having a great start to the weekend. And today we're going to talk in respect to World Oral Health Day, and that took place on Wednesday, the 20th of March. It's a day that's sort of celebrated internationally. And the purpose, of course, as is on any day, is to raise the awareness and to tell people how important it is to understand that with the rest of our body, our oral health, our teeth, our gums, everything is really, really important. And we have experts here with us in the studio, and we're going to be talking to them about what we can do, especially when we're talking about the preventive care of our oral health. So I'm very happy to introduce Dr. Irfan Shah, who is a consultant oral and maxillofacial surgeon, an associate professor at the National University of Medical Sciences. Thank you very much, Dr. Irfan, for joining us here.
Thank you very much for inviting us and allowing us to talk on this important issue.
Our pleasure, our pleasure. And seated next to Dr. Irfan is Dr. Sana Tariq, who is doing her specialization in orthodontics, and she's working at AFID. Thank you very much for joining us, Dr. Sana.
Thank you very much for inviting me. Thank you.
It's a pleasure. Okay, so, as we're talking today in reference to World Oral Health Day, would you say, Dr. Irfan, that, are we conscious enough in taking care of our oral health, or do you usually see people presenting to you when things are really at the last stage? How are we doing as a nation?
Well, I have been talking about oral health at national and international forums, and I have always spoken like this, that that awareness regarding oral health is nearly nil. Our educated communities do take good care to some extent, but the poor communities nearly don't know anything about what oral health is and what poor oral health is, and how to maintain good oral health and good oral hygiene. So the World Oral Health Day that we were celebrating 2 days ago on 20th March is celebrated everywhere to create awareness regarding oral health and prevention and management of diseases affecting teeth, mouth, the muscles of the face, the joints through which we open our mouth, and all structures surrounding the mouth and teeth.
Right, okay. As you said, that the awareness is next to nil. That is really alarming, isn't it?
It is. Luckily, since 2013, now that we have organized this World Oral Health Day every year, so through print and electronic media, we are creating awareness. We are going to schools at the very young age. We want to tell them about the significance of oral health, and oral cavity, mouth, actually is the gateway to the rest of the body.
Yes,
so healthy mouth actually means healthy body.
Absolutely.
It's not only the print and electronic media. On 20th March, we were inviting school children to our institution, Armed Forces Institute of Dentistry, and many other medical and dental colleges are doing the same thing. And we are actually visiting some schools over the next week or 10 days, and we will be creating awareness regarding prevention and management of diseases and disorders affecting mouth and teeth. So hopefully
fantastic.
The lack of awareness will disappear gradually, but it will.
Right.
Yeah.
Absolutely true. And Dr. Irfan, as you're saying, Dr. Sana, that the importance of starting young amongst children, because you'll find that they're so eager to learn, and they absorb information at that age. So rather than us fixing adults, the better way would be to get that embedded into young children's mind about the importance of their oral health.
Yes, definitely. The things learned in the early childhood definitely make your habits accordingly. If you are making children learn how to brush your teeth, how frequently to brush your teeth, how to maintain the brushing and maintain your optimum oral health, this will definitely become a part of their regular routine. You might not be giving them instructions at the later age to save your teeth. This is going to be a part of their habit. as the teeth, we have a concept that milk teeth generally they go off, and even if they get caries, parents are not concerned. Even if they get they get destroyed by multiple habits, parents do not take the children to the dentist to get them treated, because the major concept is that they are ultimately going to shed off, and the newer ones, the permanent ones, are going to take their place. It is not that simple.
Right.
When
okay.
the milk
so that's a bit of advice for the viewers who are watching with young children. It's not about being careless with their baby teeth, because then that will affect the rest of their teeth.
Definitely.
Okay.
The health of the baby teeth or the milk teeth is equally important as that is of the permanent teeth.
Right.
Yes. Like for example, if one of the tooth that gets shed off earlier than its time that is destined, and whenever the tooth sheds off immediately within a period of couple of months, its permanent tooth takes its place in the oral cavity.
Okay.
If it sheds off early, the permanent tooth loses its parts to the oral cavity. It might not erupt into the normal position. It might erupt. It might not erupt at all. It might erupt at an other position that is not aesthetic, or that is not pleasing in giving a full young smile to the child when he or she is going to be in the teenage. So we are having children that we have malaligned teeth, and we want them to be aligned to have a good pleasing smile, especially the socially active stage of the children, the mid schools and high schools specifically. Yes.
And that's very important information, actually, that the milk teeth of a child are really, really important, because they are laying the foundations for the rest of the adult teeth that are going to come in. Okay, Dr. Irfan, you are a consultant oral and maxillofacial surgeon. Now that's quite a mouthful. What exactly is your area of expertise?
Well, it's difficult to pronounce, and it's probably difficult to remember as well.
True.
Oral cavity is the medical term for mouth, and maxillofacial surgery is this part of the oral cavity and face that we are dealing with, us oral and maxillofacial surgeons.
Right.
This specialty or subspecialty of dentistry deals with diseases and disorders that affect this part of the body, and that includes injuries. So for example, road traffic accidents are very common in our part of the world. Fractures of the jaw bones and facial bones, we commonly treat them. Cancer of the oral cavity or mouth is another very common thing, unfortunately very common in Pakistan and this part of the world. We perform cosmetic surgical procedures. So if someone's jaws don't grow proportionally, the lower jaw is smaller than the upper one, the upper jaw is smaller than we correct them surgically, and we treat cleft lip and palate, and we treat diseases and disorders affecting the joints through which we open our mouth.
Okay.
So all diseases and disorders that affect the maxillofacial region of human body, the specialty deals with those disorders. Yeah.
Okay, right. You were talking about the jaw as well. It just came to my mind, lockjaw. Is that something in your area of expertise as well?
Exactly. So like I said, oral cancer is quite common. Another unfortunate thing is what we call lockjaw, which is a longer lasting condition. In medical terms, we call it temporomandibular joint ankylosis. This is the joint. Normally it is mobile through which we open and close our mouth, but because of one or another diseases or disorders, it sometimes gets locked, and the patient then cannot open his or her mouth. It's a miserable condition. So the surgical management, which is very much possible, is another part of maxillofacial surgery.
Okay, right. Dr. Sana, you were talking about children, young children, and the importance for their oral hygiene as well. Just to make it clear to our viewers, how should they be looking after, let's start from babies getting their first tooth.
Yes, the actual health maintenance of to have optimum oral health at a later stage, the procedure starts from the day of the first tooth erupts into the mouth. Basically, it is the 6 months age, the teeth start erupting into the mouth. These are the milk teeth, and as I have already said, that these are the most neglected ones. And it is the responsibility of the mother to clean the one tooth that has happened to come into the oral cavity.
And many people don't realize that. They don't realize that at all. They're just excited that, oh, baby's got the first tooth, but nobody thinks about you've got to maintain hygiene as well.
Yes. these habits start from that stage. It is recommended that you take a wet cotton gauze to clean that tooth twice a day, or to have a small toothbrush. Mini baby size toothbrushes brushes are available. And as the kid grows, we have multiple flavored toothpastes with different brands, multiple colored toothbrushes, just to encourage this habit of maintaining health, maintaining hygiene, so that at later stages we might not be landing up into certain diseases that are costing you a lot to be treated. Dental treatment is usually said to be very expensive, and mere precautions and preventive measures would lead to a very reduced burden
of the oral health.
If I may add to what Dr. Sana is mentioning, so we generally mean oral health, something related to brushing your teeth. That's not the entire story.
Right.
So in addition to keeping good oral health and good oral hygiene, we need to concentrate on good dietary habits.
Yes.
And those good dietary habit means consuming foods containing less carbohydrates and sugars, containing fresh fruits, and cleaning your teeth and mouth after every meal. And the third component of maintaining good oral health is regular professional visits.
Right.
So if you are taking good home care, that does not mean that you will always have healthy teeth. In addition to that, you need to see your dentist regularly.
You need to see a specialist to get them checked out.
So that if there is a disease, it is diagnosed and managed timely.
Right, absolutely.
And basically, this is the motto of Oral Health Day. It comprises of 3 components, as said by Dr. Irfan. One is the hygiene measures, creating awareness regarding hygiene measures. Second is good dietary habits. And third one is the regular checkups that are intended to be done every 6 months.
All right. Okay, right now we are going to go for a break, but don't change the channel. Okay, welcome back to the program, and we are talking about oral health and so many things that we're getting to find out from our experts who are sitting here today. Dr. Irfan, you mentioned, oral cancer. Now that's something that many people do not have a lot of knowledge about, maybe the signs, the symptoms. And as you mentioned, that oral cancer, unfortunately, is, common here in our area of the world, and that is because of the pan and the tobacco chewing and the chalia. Please tell us what causes it and what are the signs.
Yeah, the problem is that it's not only general oral health that awareness is lacking about. Oral cancer is a deadly disease. It's generally said that it's characterized by 3 Ds. It's disfiguring, it's deforming, and it is deadly. It's very common. Something like 350,000 patients are affected by oral cancer every year, and 2/3 of them develop in developing countries. It's more common than blood cancer. It's more common than many other cancers that we are familiar with. It's 5 years survival, which means the long-term prognosis is very poor. The best thing that you can do about it is preventable. We know what causes oral cancer, and early diagnosis leads to better management. Unfortunately, because we don't know about much.
And those are some pictures that we have right now that are on the screen. What is that?
So this is exactly an oral ulcer-like lesion. It's looking very benign, but this is an early stage of oral cancer, and we should ideally be diagnosing oral cancers at this stage.
I see.
Unfortunately,
and for many people, that would look just like a normal mouth ulcer.
Exactly.
Yeah.
So if a few things are met, like it happens generally in elderly individuals more than 40 years of age.
Okay.
If they're smokers, if they consume alcohol, pan, chalia. If an ulcer like this develops in these individuals,
they're at high risk.
Yeah, they're high risk people. So then we must suspect that this is nothing routine ulcer. Then it's rather something more than that.
I see.
So then we need to see our dentist,
Right.
who can take a specimen from it and then send it for laboratory for permanent diagnosis.
Right, okay. And so that is one of the early signs, as you said. Tell us what happens if a person does not, go and see a dentist at that time. What are the
So the early signs would not always be an ulcer.
Okay.
If the normal healthy mouth looks pink and red inside, if this normal color is changed, if it is whitish or blackish, that is an early sign of cancer.
Okay.
If it is ulcerated, it's a cancer. If it is a swelling of unknown cause, there is no good reason why there is a swelling, then it is probably a cancer tumor as well. So if you don't treat, the ulcer will increase in size. It won't heal.
Right.
Ultimately, it will destroy the structures in the oral cavity, and sometimes it comes out of the mouth as well. So those are advanced stages, and unfortunately, we get many patients in advanced stages where the treatment is difficult and it does not lead to permanent cure.
I see.
So we need to catch oral cancers very early, really. And it's through oral health day and programs like this that we are creating awareness regarding oral disease, including oral cancer. Yeah.
Okay, right. Now, as you said that the risk factors that are involved in this, those people should be very vigilant as well. So we see that, Barn and the Chalia is something that is, quite promoted within the family, if you think as well. People will often indulge in that. So how can you deal with that at home? You have elderly people who are often addicted to this. So
more than pan and chalia, I would like to speak against tobacco.
Okay.
So it's one of my favorite topics. I have actually spoken on tobacco and its related diseases and disorders around the world. Tobacco affects all parts of body, from the hair to the toes, including mouth and oral cavity. Tobacco contains hundreds of chemicals, and at least 60 to 70 of them are cancer causing, all parts of the body. So it's like putting 70 causes of cancer in your own mouth.
My God, yes, imagine.
It's avoiding tobacco in all forms, including smoked and non-smoked tobacco.
Right, okay.
And this pan and chalia contains tobacco and other chemicals that lead to ulcer.
Right.
So healthy habits, as we mentioned moments ago, include avoiding these poisonous chemicals.
Being intelligent about what basically it's common sense. Being intelligent about what you're actually putting into your mouth.
Exactly.
Isn't it? Okay, Dr. Sana, tell us about your area of expertise. You are specializing in orthodontics. Now, when you think of orthodontics, you just think of, the braces on people and things like that. What exactly is your field of work?
Yes, basically we tend to, or we aim at giving people good smiles by aligning their teeth. And it is not just related to the teeth, or you can say it involves the adjacent structures, the bones, The teeth which are linked to the bones and the joints and everything it is not basically orthodontics. It is orthodontics and dentofacial orthopedics.
Oh, that's another mouthful. Not easy to say.
It actually starts from very early age,
Okay.
when we have children that are growing in their growing age, and we anticipate that there is or we experience deficient growth of one part or the other part of the face. So we aim at accelerating that growth by different appliances. And when we are experiences excessive growth, like of the upper jaw or the lower jaw, then our treatment aims at restricting those effects of that excessive growth. So it starts from modulating the growth.
Okay.
This is what we say as functional jaw orthopedics, or in simpler words, functional modification or growth modification.
Right.
And then the second phase, or this when the teeth all the teeth have been replaced by the permanent ones, then we aim at aligning those teeth.
Okay.
This is basically done by braces. And when the children have grown, or we are having nowadays the adult orthodontics is emerging.
Yeah, you
Adult
do see adults.
Yes,
with, yeah.
and it
Is the
number of
success
them-
rate the same as with children, or
yes,
is it?
yes.
Okay.
In adults, the success rate is equally dependent on the patient part as well. Your habits, your healthy, you can say, healthy diet.
Approach to the
Yes, and your overall general health as well.
I see.
We have been treating patients of 40 plus of age. There are multiple comorbids like diabetes, hypertension, and if they are controlled, the success of orthodontics is almost equal to what we are treating at the younger ages.
Right.
And since it is emerging, then orthodontics is also emerging. We have invisible braces now coming into the market.
Yes,
And
yes.
because it is the adults
Right.
who want good smiles as well, and
definitely.
not being pointed out.
For
by-
many
yes.
people, it can be life-changing as well.
Yes,
It
yes.
can be, for many people, it could be the smile that they were very, very conscious of. And, sometimes you have teeth that are a bit more forward than the rest of the teeth. For some people, it's very, very, for them, it hurts their confidence or their self-esteem. So to have that aligned would make a huge difference to them.
Yes, we have multiple statistics that have said that about 7% of the people, or 7% of the children, they are being mocked at their younger ages because of their dental features.
True.
And about
Bullying.
out of those 7%, 40% are the kids that are being mocked about their rabbit teeth, the teeth that come out of the mouth.
Yeah, that's true.
And basically that is, and this also has a very strong negative impact on their development, psychological
Of course,
development.
of course.
And they get shy, and the lack of self-esteem, lack of confidence. They might not develop into an individual that they are defined genetically because of this societal pressure and mocking. And
So what Sana mentioned is that now adults can have as successful orthodontic treatment as younger children. I would like to add that by no means should you wait for 40 years and 50 years. The sooner you start, the sooner you visit a dentist, the sooner you visit an orthodontist, the easier the treatment is.
Of
So
course.
if you visit the orthodontist at an early age, it's possible to treat them with braces, which is non-invasive, non-surgical management. If you don't do it, and if the growth advances to an extent, then the surgeon comes into play. And we generally advise that surgery should be avoided if possible. If
It's
not
the
possible,
last
then it's
resort.
the last resort, exactly.
Okay.
So unfortunately, we are getting many patients who have never visited an orthodontist in an early age, and then we treat them surgically. The surgical management
see.
is very successful as well, but again, I would say never wait for the deformity to develop so much that you need surgery.
Again, you're talking about the preventive care,
Exactly.
that this can be avoided, to have extractions of teeth if they can be just treated at an earlier stage from your orthodontist.
Exactly.
That's absolutely true. Now, let's talk about one thing that's really close to my heart, and we're doing a program on oral health, is phobic patients. So how do you deal with those? How do you deal with a patient who has come to you as a last resort because they have been in pain or they haven't been, looking after their teeth because they were scared of going to the dentist. So what are those? How do you handle those? What tips and techniques?
So it's a common everyday phenomena for us. We every day come across patients who have avoided dentist for months and years.
Really?
They have lived
How
with,
many of a percentage of that?
I would say it was very common in the past. With improved techniques, with improved anesthesia, dentistry should no more be considered to be painful. Our anesthesia is much better now. Our instruments and equipments have developed a whole lot. Our techniques and our interaction with our patients have improved a whole lot. So now patients who have had bad experiences in the past, they're generally afraid of dentists and dental chairs and dental clinics. But if you treat them with patience, if you treat them carefully, with caring attitudes, many of them ultimately turns to be good patients, regularly visiting our clinics for their dental treatment.
It's developing that trust as well, isn't it?
Exactly.
Because at the first time, it's like, it's also the position of the chair, I think, the dental chair makes you feel so vulnerable. Sana, you have something interesting to share with us about one of your
In
phobias.
childhood, I was also a very phobic child,
Okay.
and one of the dentists, he treated me once by making me sit on a casual chair, not the
Okay.
dental chair,
Okay.
just to make me acclimatize to the instruments.
Right.
Or basically, the fear is, as you have said, that it is the dental chair or the position of the dental chair that makes you like you don't have control over yourself, and the other person has all the charge of you, and that makes you fear.
True.
And the voices of the handpiece.
Oh yeah, and the anticipation of what's going to happen next.
Yes, you cannot see what is happening to
the
you.
anxiousness
Yes.
is builds and builds. That's absolutely true.
So as Dr. Ifansha has said, it is basically the patience of the doctor, and as we have evolved in dentistry, we have also evolved in communication with the patient as well. We have a technique that is known as tell, show, and then do. You tell the child that what we are going to do, or if you have a facility, then you show the child the procedure on photographs or video, or and then show the child that this is the instrument, I'm going to use it in your mouth.
Okay.
And basically it is making him or her acclimatized to the environment.
And also
basically.
part of the procedure.
Exactly.
That way they don't feel so alienated, I
Yes,
suppose.
yes.
Right, absolutely. Okay, Dr. Irfan, tell us about the common procedures that you're involved with. What are the main?
So before that, I would like to talk about the common diseases that affect the teeth and mouth. The most common is probably dental cavities. A study shows that 95% of the individuals develop cavities in one or another of their teeth in their lifetime. So this is like almost everyone would develop
everybody's
them.
going to
Exactly.
have a cavity.
The second most common thing is gums diseases, bleeding gums.
Right.
Bad odor or bad breath is another common condition. Crowded teeth that Dr. Sana treats so well in her department and her specialty, there's another common cause, common condition affecting teeth and mouth. Ulcers developing in the oral cavity or mouth is another common condition. Injuries to the teeth and the surrounding structures is again a common thing that happens on the roads every day in our country and in this entire region, entire world actually. So these are the common diseases and these are the common conditions that we treat on a routine basis.
Right. Tell us about cleft palate as well. And the
Cleft palate is a developmental deformity. Normal healthy individuals develop faces that are intact. The upper lip and the lower lip are one structures with the oral cavity opening there in between.
Right.
So if the upper lip is divided in two parts, in simple words, this is what we call cleft lip.
Okay, cleft lip.
Cleft is a defect in the upper lip.
Right.
And if the defect extends posteriorly in the mouth, then it can affect the palate as well. So then we call it cleft lip and palate. Then it is a communication between mouth and nose. And it leads to a number of effects secondarily. So we as oral surgeons, oral maxillofacial surgeons treat these clefts surgically, and orthodontists treat the dental components of the clefts very well. In their department specialty.
Sana, tell us how your both expertise complement each other in this.
Yes, I would start with the awareness of the general population. It is quite a prevalent disorder, having 1 out of every 700 live births in UK reported with a cleft cleft palate, cleft lip, or any form of, or combination or isolated ones.
Okay.
And in India or in our region, you can say the number is 1 in 276 live births. So it is quite common.
Right.
But
Nearly half.
Yes, but we as a nation are unfortunately not quite aware what are the causes of it, and how they can be prevented, how they can be diagnosed, and how they have to be managed.
Right.
So starting from the cause, it is basically the inter-family marriages or consanguineous marriages. This is
Right.
basically one of the cause of, the major cause of these genetic disorders that include clefts. There are multiple other genetic disorders, syndromes, etc. But the most common of them is cleft. And the treatment, we should emphasize on the prenatal diagnosis of clefts. We have multiple 3D or color Doppler ultrasounds that are available, and they are very effective in diagnosing clefts intrauterine. And purpose of this is you can counsel the parent,
So that they'll be ready and
they
prepared.
should be ready,
Okay.
and they should not get a psychological trauma by looking at the patient, their child. They
Right.
were anticipating something else and they got
Right.
something else.
Absolutely.
And the mothers, it is reported that the mothers go into depression phase, and
Somehow
parents-
they may be blaming themselves.
Yes, yes. It is also a common.
Many myths and
Yes,
superstitions associated with this.
superstitions,
Yes.
And it is not just because of the illiteracy of our people. Many literate people also think that it might be because of some superstition or some other like jadoo and stuff like that. But it is for our awareness that the cause is just the genetics, and the genetics and some environmental factors, that maternal vitamin deficiencies and certain medicines that are taken by mother during pregnancy, they
Right.
can lead to clefts in the children.
Okay.
So we would be.
So
we should
in
be.
other words, any mother who has had a baby with a cleft, as you said, deformity, it's not your fault. It's
Yes,
nothing that
not at all.
it's nothing you've done wrong during the pregnancy.
Yes.
The factors Dr. Sada has told us about.
And
yeah.
mother or the parent should not be blamed for having a child with such a deformity.
Right,
Yeah,
right.
they must be sympathized or empathized with, because
And
they are
then
having-
again, it's easily treated,
Yes,
as you said.
yes.
Yeah, that's the most significant thing. That if it has happened, it has happened. Don't worry, it is very, very manageable. And your child probably would look as normal as any other individual. So the happy thing is, the not so happy is that it's common. The happy thing is its management is very much possible. Yeah.
Absolutely, that
And
is very
one
important.
point that must be highlighted is the management starts from the day the child is born. We are very concerned about the repair of the lip, and we go to the surgeons, and but we neglect the procedures that must be undertaken before the surgery is being carried out.
Right.
To facilitate the surgeon to have a good lip repair, to have an aesthetic outcome, we must undergo few steps that are necessary. The child might be crying, or I have pictures of you, if you can share with them. It is a plate, a feeding sort of plate that we give to the child, and that not only assists the child in taking the feed in, but also it aligns your bony structures inside the mouth, and then we do a taping over the mouth that brings the lip portions together. And the soft tissues of the babies are quite moldable, and you can
Right.
stretch them towards each other,
Right.
making this it easy for the surgeon to repair it. We might not face multiple complications after surgery, that lip tears away after being repaired.
And as you're saying, this is very, very important for the
Yes.
foundation of the,
Yes.
when we're going up to the surgery. This is a very important component of that,
And
the prerequisites.
and it is
Right.
basically a success determining factor for the
Okay.
surgeons to have
Okay.
achieved an aesthetic lip repair, or basically it is a God's half done job, and it could not, if the God has left it half done, we might have to put a lot of effort to make it near nature, to achieve the outcomes that are near to the nature.
Right.
So this cleft deformity looks a small problem, but it's such a big problem that no single specialist in medicine and surgery can treat it alone.
Right.
So it's always a teamwork, and that team consists of orthodontists, general dentists, oral and maxillofacial surgeons, plastic surgeons, ENT specialists. So it's a teamwork, and this treatment continues or not a day or two or a week or two. It continues over months and years.
Oh,
But
okay.
I can assure the mothers that the treatment is very much possible. They should bring their newborn children to us as early as possible, so that we can give them advice and we can consult them and we can continue with the treatment according to stages.
And I suppose the main concerns that you usually have are for the new mothers.
Exactly.
Is that it would be hard for them to think that they have to give up their baby to have a procedure. But then that's where I'm sure you're counselling them, for them to understand that this is for the long run and it's much better to have this done now, as you both said.
Exactly. So mother is of course the most concerned, but it's the entire family. So the father is concerned as well.
Okay.
The grandmother and grandfather are concerned
the grandmother
as well.
and
And if we consult them and if we tell them that this is manageable,
Yeah.
so everyone will be relieved.
And I'm sure they all have millions of questions for you.
So we are telling them most welcome with as many questions as possible,
Right.
as much discussion as they would like to do. We are here to help them.
Fantastic.
Yeah.
And as our experts told us, Dr. Irfan, Dr. Sana, this is something that is easily treatable, but the main thing is that it's a sort of collaboration of many specialists, and you have to get this done as soon as possible, which is the main thing. Okay, let's talk about other health issues that can give you a sort of a compromised oral health. What issues like diabetes?
Yeah.
And
So, like we mentioned earlier, oral cavity or mouth is the gateway to the rest of the body. The rest of the body can affect the mouth or oral cavity as well.
Right.
So, like you mentioned, diabetes is a disease that affects all parts of body, including mouth. So, diabetic patients are generally prone to develop more infections.
Okay.
And those infections could be dental infections as well. And those infections can spread outside the mouth then. So, we need to tell the diabetic patient that they must maintain very good, very strict blood glucose control. If they maintain their glucose control well, their mouth and oral cavity will remain healthy.
right.
If they neglect that glucose level, then oral cavity the patient will lose teeth earlier. There will be gums diseases. They will develop more cavities. So strict control of diabetes is very important. But diabetes is not the only thing that affects oral cavity.
Okay.
So bleeding disorders like hemophilia affects the mouth. There are multiple gastrointestinal diseases, stomach diseases that affect oral cavity. So for example, they can lead to multiple ulcers in the mouth. Some autoimmune diseases can affect the oral cavity. Some serious conditions like HIV and AIDS they first sometimes manifest in the mouth and oral cavity. So many conditions can affect the health of oral cavity. And the dentist actually has to stay vigilant for those signs and symptoms so that they can diagnose the systemic disease as well. So it's two ways.
Right.
Yeah.
So okay. So unfortunately, we've come to nearly to the end of the program. It's been a pleasure having you both on, and thank you so much for all the information and advice that you've given us. Before we sign off, a short message from both of you, Dr. Irfan first.
So thank you very much. I would like to tell my audience that please take very good care of their teeth and mouth so that the rest of body stay healthy as well. So healthy teeth and healthy mouths means healthy bodies.
Wonderful.
Yeah.
And Dr. Sana?
Thank you very much. My take-home message for the audience would be that prevention is the ultimate success determining factor.
Absolutely.
And you must be careful about what God has given you. So teeth, they come once, and you cannot be, and if you go towards the rehabilitation, you come to know that you have to spend a lot of money.
Absolutely.
So you must take
save
care of
yourself the
Yes.
time, the trouble, and the finances as well.
yes.
Okay, Dr. Irfan and Dr. Sana, thank you very much.
Thank you.
Thank you.
Okay, and with that we come to the end of today's show, and certainly something that we do not talk enough about, our oral health, and I hope that you've picked up on all the expert advice we've had from our guests today. So until next week, stay happy, stay healthy, bye-bye.